Good morning, all of you. Myself, Adil Ahmad. I am from Kashmir. I am working as a nursing tutor in Faculty of Nursing, Rama University. Let me discuss today's topic, which is on meningitis. It comes under central nervous system disorders. Let me discuss first definition. Meningitis is the inflammation of protective membrane coverings of the brain and the spinal cord, known as meninges. So meningitis is actually the inflammation of the protective membrane coverings of the brain and the spinal cord. The inflammation is usually caused by infection of the fluid surrounding in the brain and spinal cord. Meningitis is life-threatening because of inflammation proximity in the brain and the spinal cord. It is classified as medical emergency. So meningitis is a system of membranes that envelops central nervous system. It has three layers. First, dura mater, arachnoid mater, and pia mater. So dura mater is the outermost layer that surrounds and protects the brain and spinal cord. So arachnoid mater is the space that is lying between the arachnoid mater and the pia mater, which is filled with the cerebrospinal fluid. So pia mater is the innermost layer that is filled with the connective tissue. So next, move to the causes. So first cause is the bacterial infection. Bacterial infection, the agents that cause the bacterial infection are Haemophilus, influenza. Next one is meningococcus and pneumococcus. These organisms cause bacterial infection. Next one is the viral infection. Viral infection that is caused by the viral infections. The organisms that cause viral infections are enterovirus like ecovirus, influenza, HIV, simple herpes virus. So next one is the fungal infection. In the fungal infection, first one is the cryptococcus, histoplasma, and candidas. These agents cause the fungal infections. And next one is the parasitic infection. The organisms that cause parasitic infection are amoeba, plasmodium, and toxoplasmosis. And also sometimes the physical injury may also cause meningitis. Some patients having cancer, they may also can get the meningitis disease. Due to some certain drugs, namely the non-steroid anti-inflammatory drugs, those patients who are using long time for these inflammatory drugs may also get meningitis. Due to the serious head injury, patients may also got the meningitis. And also next one cause is the middle ear infection. Due to the middle ear infection, patient also may get sometimes meningitis. So next we move to the risk factors. In the risk factor, first one is the age. The children younger than the 5 years may also get the meningitis, and the age. In the age, children younger than the 5 years may also get meningitis. Use of immunosuppressive drugs. Some patients who are using immunosuppressive drugs for a longer time may also get chance of getting meningitis disease. Due to the chronic malnutrition, a patient may also get meningitis. AIDS, some AIDS patients also get a chance of getting meningitis. Chronic alcoholism, those patients who are using long time alcohol drinking may also get chance of getting meningitis disease. And some diabetic patients also risk of getting meningitis, and pneumonia patients also get meningitis. So next we move to the pathophysiology. So in the pathophysiology, the causative agent enters in the blood stream. So when the causative agent enters into the blood stream, so it next crosses the blood brain barrier. when the causative agent enters in the bloodstream, it crosses the blood-brain barrier. After that, inflammatory responses in the meninges. So when the organism crosses the blood-brain barriers, inflammation response in the meningeal layers. When the inflammation response in the meningeal layer, inflammation of the subarachnoid space and pyometer occurs. When the inflammation in the subarachnoid space and the pyometer occurs, after that CSF flows in the subarachnoid space. When the inflammation of the subarachnoid space and the pyometer occurs, after that the CSF flows in the subarachnoid space. When the CSF flows in the subarachnoid space, CSF cloudiness और infected. CSF cloudiness हो जाता है या infect हो जाता है. After that CSF cell count increases. CSF का जो cell count है वो increase हो जाता है. After that we move to the sign and symptoms. So first sign and symptom, having a severe headache. Those patients who are having meningitis may having a severe headache, maybe the first sign and symptom. Next one is the irritability. Those patients who are having meningitis, these are maybe irritable due to the inflammation in the brain. Next one is the restlessness. Patient may feel restlessness. And next one is stiffness of neck. This one is the main sign and symptom found in the meningitis patients. After that also some patients go to the coma due to the chronic inflammation in the brain. Some patients may go to the coma. Also next one is also disorientation. Due to the chronic inflammation in the brain, some patients may unable to recognize anybody's name, place and time. Also tachycardia, increased heartbeat seen in the meningitis patients. Also high grade fever. Some patients may have high grade fever seen in the meningitis patient. So next diagnostic evaluation, how we diagnose if patients having meningitis or not. So first diagnostic evaluation is the history collection. Next one is the physical examination. So first history collection, we take the history of the patient, previous history also, if patient having previous history of meningitis, and in the physical exam, head to toe physical examination we do it in the patients. After that CSF evaluation for pressure protein and leukocytes. After that, blood test like CBC, MRI, MRI also done in the meningitis patient, and CT scan, and two positive confirmative tests are also done in the meningitis patient, which are the Kernig sign and Kernig sign, Kernig sign and Gruzinski sign. In the Kernig sign, when the patient is flexed, the thigh flexed on the abdomen, the patient is not completely move his legs. The patient may feel severe pain and hamstring muscle in legs. And in the Gruzinski sign, when the patient is lying in supine position, hand flexed upwards, resulting in both the hips, knees, and ankles, neck flexed, resulting in some patients show meningeal irritation. So after that, complication. What will be the complication if the patient having meningitis? So, due to the increased cerebrospinal fluid, there may be the patient may have severe visual loss, cerebral edema, and tissue damage. And so these are the complications of the meningitis. The patient may have severe visual loss, cerebral edema, and tissue damage. After that, the last one is the management of the meningitis. First, we give antimicrobial therapy. In the we give the antimicrobial therapy to the patient, and next one we give the antibiotics. Antibiotics like penicillin G, amoxicillin, amoxicillin 625 mg. We also give anti-inflammatory drugs like dexamethasone. And also we give anti-symptomatic drugs. Anti-symptomatic drugs like analgesic for pain relieving, antiemetics like domperidone for those patients who are having vomiting, and also we give sometimes anticonvulsants like phenytoin giving to the patients, and also antiviral those patients who have viral infections like acyclovir we can recommend to the patient. So these are the medical managements for the patients who are having meningitis. After that, the nursing management. In the nursing management of shock by IV therapy. Those patients who have shock like symptoms, we can give IV solution to the patients for the shock treatment. After that, we provide management of airway clearance provide O2 to the patient. O2 therapy to the patient. And also we check vital signs every day. Check vital signs. We also give supportive therapy to the patient. Supportive therapy. We have seen from first to see we definition of the meningitis. After that we see the causes, risk factors, pathophysiology, sign and symptoms, and diagnostic evaluation and complication. And so last one we see the management. Thank you.